My name is Dr. Robert Antelak. I am speaking here from our dental office in Shelby Township, in Michigan. We've been here and we have a very high-tech dental office. But today I'm going to be getting, by the way, you can reach us at thegentledentist.com is our website, and our phone number is 586-247-3500. If you see something that you like here, well, with my talking at least, give us a call. We'll be more than happy to be of dental service. We give second opinions if you like, and we're here to help serve our community and to help create some awareness about what's happening in dentistry. But one of the most important things that we talk about or can do is dental hygiene. And to introduce dental hygiene, it's something that some people aren't even aware of how to, or they've never been taught or shown how to take care of their teeth and what to do to brush their teeth. And so I'm here going to be discussing that today. And here is my buddy George, and George is going to help demonstrate how to brush his teeth. He's nice because he's nice and compliant. What we do with George is, this is a toothbrush, and this is a manual brush, of course, obviously quite larger than you would use. Electronic toothbrushes work very well because they will do it automatically, and it does it by power, and so the way it spins or vibrates, it does a much more effective job than what we can do with a regular standard toothbrush. So if you have that, the same techniques do apply. So what you want to do is start off, angle your toothbrush up to the side of the gums at a 45 degree like this. You start off in the back and make sure that you not just brush the teeth, but you get that interface between the gums and the teeth, and you just go around the whole surfaces of these teeth. Do it methodically, do it all the surfaces, almost be able to feel those areas as you are brushing, okay? Then once you get the outside, you do the inside, and you kind of go in like this and brush on the inside there up to the roof of the mouth. Once again, get the connection between the teeth and the gums. When you're done with that on the top, you just do the lower ones. You want to spend about a minute and a half or so brushing your teeth each day. I recommend at least twice a day, preferably the morning, and then before you go to bed, and in between if you can get it done. And then also your lower teeth, you want to get around the gum line. Once again, going down to the gums and brushing on a 45 degree angle down to the gums, right at that interface. And this is a very common area between here and here for people to skip. What happens is they start going off like this, then they get to a certain point, then they start over here, but they skip this whole area here. So the gums become quite inflamed and swollen. So continue around and get on the outside here and go on the inside and brush on the inside of the area here. Make sure that down in these regions down here in the bottom that you go ahead and brush that really well too. So with a regular manual toothbrush, you go in circles. With an electric or like a Sonicare, for example, you hold it in that position and you let it do the work for you. So it does the work for you, spins or once again vibrates, and it does an effective job with that. So basic hints on that are use a fluoridated toothpaste. When we use a rinse, use one without alcohol. Alcohol can really dry out the mouth. Unfortunately, Listerine or Scope, those things contain a high level of alcohol, and they can dry the mouth out, which can lead to a problem with that. And you can use a fluoride. If you have a problem with that, your dentist can prescribe fluoride for you. Fluoride will actually help to strengthen the teeth. So the question is how do cavities form? Why do we brush our teeth? Well, cavities form by those little bacteria getting into the deep recesses and grooves of your teeth or between your teeth. And if you have sugar like in pop or candy and things like that, and there's so much sugar in everything that we eat now that it can actually get on there. The bacteria in your mouth, everybody has it, uses that sugar as a food source, but its byproduct is an acid. As that acid sits in the enamel of the teeth, then it ends up dissolving that, and that's a hole you get from a cavity. So therefore, when your dentist is going around and checking those areas, it's a soft area that catches, is because the enamel on the outside has become soft. So fluoride works really well to help to remineralize that and make it a stronger structure. So that's what we do on the outside. Something about mouthwashes, non-alcoholic, and using a fluoride, sometimes a fluoride supplement if people have a high risk for getting cavities. Now, one of the reasons what we want to use this dental floss for is dental floss is used to get between the teeth. And we have our other model right here to do that. And what we want to do is, the reason why we want to get between the teeth is that's where bacteria grow that cause gum disease, which causes bone loss. Periodontal disease or gum disease is the #1 reason why adults lose their teeth. As you lose the bone around the teeth, they become loose and become infected. Those infections can get into the bloodstream over a period of time. Those infections can also accumulate. The bacteria that's from those infections and swelling can actually affect the heart, can affect the heart arteries. The bacteria that's found in the gum pockets of gum disease have been shown to be also in the presence of the arteries in the blood, or the arteries in the heart. So you have hardened. So the important thing is keeping the mouth healthy. The healthier you keep your mouth, because it contains millions and billions of bacteria, the healthier you keep your mouth, the less that your body has to fight off that infection. Okay? So what we do is between the teeth we use dental floss, and dental floss is used in a certain way where we actually, if this is a tooth here, we take the dental floss and wrap it around it in a letter C shape so it gets between it, and we go up into the gum line and then down. So as a demonstration here, we would, like for the front, for example, we would get in here and shape it and get right down into that gum line like that, and go up and down, then shift it over to the other side and then go up and down. And what that does is it cleans off all the stuff between the teeth. I have a lot of my patients, they come in, oh, I floss, and they do this back and forth thing. Well, that really doesn't do a whole lot when you go back and forth. You get the motion by the up and down motion is what kind of cleanses and scrapes that stuff off of your teeth. So you want to use about 18 inches of that. You wrap it around your middle finger. Any floss will do. If you want to use whatever kind you like, you wrap it around your middle fingers like this. Then you have your index fingers and your thumbs that you can use to help manipulate that around your mouth. In the back, you can use your thumb and your index finger and go in there that way, and then switch, or use these, whatever feels comfortable to you. Flossing is a great way of doing it, and obviously your dentist and everything tells you, and the most common thing I say when I ask a patient, so how much do you floss? Not enough, I don't floss enough. And so everybody has this feeling of being convicted of not flossing. So what there is right now is there is a product out, it's called the shower floss. It's just totally great. It actually hooks up to your faucet if you look at that. I'm not here to promote that or anything like this, but I just know it works very well. And it fits right onto your shower head, and you have a little tube that comes in here, and it hooks up to a little end there, and where that little end is, that you just put that right between your teeth like this. You put that next to your teeth, and you allow a stream of water to go right between your teeth while you're taking your shower. It's convenient, and it introduces oxygen into those gum areas, and the bacteria that cause these problems cannot live in the presence of oxygen. So whenever water is introduced in that area, it helps to kill off those bacteria, flush out any food products, debris that's in there, and so the teeth clean. I use it and I think it's great. It works really, really well. And so we know that cavities are formed by these bacteria, and the way that the bacteria uses the sugar to cause the cavities, but also there's that definite connection between heart disease, diabetes, smoking. It's all interrelated between our body, our mouths, and the rest of our body, and what can be caused by that. So oral hygiene is very important. Taking care of yourself, your mouth not only makes you feel better, and it just gives you a better sense, and it's also healthier too. So for more information, you can call us at our office at 586-247-3500. Visit our website. We've got a lot of good information there, and that's at gentledentist.com.